Assalamu alaikum, the communication day. First scenario, Mrs. Hind Ali, 35 years old. She was admitted 2 days ago as a case of pulmonary embolism. She is known to have antiphospholipid syndrome. The hematology consultant prescribed warfarin for her. She read about warfarin side effects and she's very worried about it. You are the senior house officer in the call today. You have been asked to discuss this issue with Mrs. Hind, answer her questions, and address the concerns. You can start. Here you go.
Hello,
Hello.
I'm Dr. Henry, one of the senior house officers here. May I please confirm if you are Miss Hind Ali, 35 years old?
Yes.
How are you feeling today, Miss Handy?
Yes, I am good today.
All right. I came to discuss something with you concerning your health condition. Is this environment okay for us to discuss?
Okay.
Okay. Thank you, Miss Hand. Just to ensure that we are on the same page, could you please tell me what you understand concerning your health condition?
Yes, doctor, since 2 days, I developed severe chest pain and shortness of breath.
Okay.
Actually, it was severe pain.
Okay.
My husband brought me to the hospital by the ambulance, and some blood tests and imaging done for me. And they said that I have a clot in my lung. So some medication given to me, and I am good now. I am waiting for discharge or what will prescribe it to me.
Okay. Actually, first of all, I want to know that we are very sorry for the delay, for the waits, for you waiting for this long. Actually, the consultant in charge of your case have truly given us giving you a medication that you can take on discharge. But just to ensure that we are in together, have you been informed concerning your diagnosis?
Sorry?
Have you been informed concerning have you been counseled concerning your diagnosis, what you have, the clot in the lungs that they found?
Yes, yes, yes.
Okay.
One of the doctors explained me what happened for me, and she said that you had a clot
Okay.
in your blood channels of your lung. Yes.
Okay. Right. Actually, the consultants have prescribed a medication for you called Warfarin. Have you heard of that before?
No, no. What's this?
Do you mind if I tell you more about it?
Okay.
Actually, Warfarin is a blood thinner. Is a medication that typically prevents blood from clotting. Actually, so due to your condition, the consultant has prescribed this medication because for your best interest, it is a medication that has been shown to be effective, and it tends to make the blood in your blood channel not to clot. So that is the reason why the consultant has prescribed this medication. Actually, I don't know if it is what I've said so far. It's clear to you.
Sorry.
I don't know if you understood what I explained just now.
Yes, yes. You say that warfarin it is a blood thinning medication. Yes, I understand what you say, but I want to tell you that I am taking aspirin. It is the same because I have problem in my blood before.
Um, your question is valid. Actually, aspirin is also a blood thinner, but a lower strength blood thinner compared to the warfarin. And in you taking the warfarin will not in any way, you taking the not in any way affect your prevent probably interact with the aspirin that you have been taking, because the warfarin tends to have a higher power and strength to prevent blood from clotting compared to the aspirin. I don't know if that is okay, if that is clear, Mr. Hand, Mrs.
Okay,
Hand.
yes.
Okay.
Okay.
Okay. All right. This medication actually, like any other medication, has its own drawback and benefit. One of the benefits, like I said, it prevents blood from clotting, and you go to take this medication for a very long time, if maybe for life, and it's good. I tell you I discuss some of the drawback or the side effect of this medication, which include one, it it can cause some bleeding tendency, might like spots bleeding or bleeding from any part of your body, but not to worry. With regular monitoring of the level, we may tend to prevent that from happening to you. So what it means is that we'll be doing a regular or constant monitoring of the level of the warfarin through a marker known as the international normalized ratio. So with that marker, we can be able to detect when it is going up or when it's coming down, and then prevent the side effect from occurring. I don't know if that is clear, Ms. Hand.
Okay. So
Okay.
you mean that I will need to be in follow up for this medication? Am I right?
I'm afraid so. Yes, Ms. Hand.
Okay.
However, there are certain parts whereby we might need to alter or change the medication in such circumstances, such as pregnancy. If I may ask, sorry, are you planning to get pregnant anytime soon?
Yes, I'm planning for pregnancy.
Oh, okay.
But actually, I have a problem. As I said, it is called antiphospholipid syndrome, and this problem before caused maybe 2 abortions or miscarriage before for me. But I am still also insist to try to get pregnant.
I'm so sorry for the miscarriage you've had. My condolences. As this warfarin is one of the medication we give to individuals to prevent further complication, because what you just developed now, which is the blood clot in your lungs, is one of the complications of your antiphospholipid syndrome that you have. However, this warfarin will prevent you from having another blood clots either in your blood channels, any part of your blood channels, both in the lower your legs, your brain, any part. It prevents you from coming down with clots. Like I said, I don't know if, but once you get pregnant, we may need to stop, and because it is not safe in pregnancy. So at that time, we need to discuss with the fertility doctor, and then we need to stop and change your medication to another type until
2 minutes left.
Do you have another? And also, if I may ask, sorry, when taking this medication also can also react with other medication. So we need to put on a wristband and put on also your notes that you have this you on warfarin. And at the same time, if this medication can also interact with any other medication, and also like pills, contraceptive pills too. So you may need to consult a doctor before making any changes taking any medication at all. Do you have any other concern, Ms. Hent?
Is there no another medication can I take to avoid this problem in the pregnancy and avoid this follow up for checking my blood?
Yeah, your question is valid. Actually, there are medications you can take when you get pregnant, which in that point we have to be giving you through your more like an injectable injection. But warfarin is a drug that is taken through your mouth in pills. It comes in pills. But when that time comes, we may change it to an injectable ones. And also, we also have other oral medication, but they're not being shown to be as effective as this one in your own case. That is why the consultants, decide to prescribe this to your best of interest, to the best of your
So
information.
what will happen if I forget doses of this medication?
Missing one dose, however, it may not really do much, but when you miss dose consequently, that might be, in fact, missing a dose might be detrimental. So I will advise that once you're on it, you should continue taking the drugs, and then we'll monitor you with the blood test, like I said initially. Any other concern?
No, thank you.
All right, so I'll give you a leaflet that will tell you about the medication, the side effect, and feel free to contact us at any time. Thank you very much.
Okay, time is up. Dr. Hani, you can comment now. Well done, Dr. Henry.
Okay, well done, Dr. Henry. So this is a common scenario actually in the exam. Here there's an indication for warfarin because the patient have antiphospholipid syndrome. So a drug's not appropriate here. I mean direct anticoagulant or anticoagulant like apixaban or dabigatran or rifaxiban. So it is not appropriate here. So it is you need firstly to talk about the advantage of warfarin in this case. Okay. So as you said, warfarin is a type of medicine known as anticoagulant. It makes your blood flow through your veins more or your blood channels more easily. And this means your blood will be less likely to make a dangerous blood clot. Okay, and it used also to treat blood clots and help to prevent future blood clots. And you say you need to say warfarin is very important drug in your condition, and you have to be completely compliant on it to control your condition. And on warfarin, your condition will be controlled, and the chance of further blood clots would be extremely rare, and you can live near normal life. Without warfarin, your condition may deteriorate, and you may have recurrent blood clots in futures, which may be threaten your life. This is the importance of about the importance of warfarin. Firstly, the disadvantages of warfarin, you can say like any other medication, warfarin has its own complications, like increased blood thinning, which may lead to bleeding from any body orifice or bleeding in the brain. Also, it can cause skin rash, feeling sick or being sick, loose motion. Okay, but if you experience any symptoms like that, speak with your doctor or pharmacist for advice. But weighing the risk versus the benefits of warfarin, the benefits is extremely more. And this medication prescribe it for you in the best interest of your case. Okay. About the complications, how we can overcome these complications. Sorry. So you will be given a YOLO anticoagulant treatment booklet. YOLO anticoagulant treatment booklet. You need to read this booklet carefully, as it gives you information about when you should contact a doctor for advice. Carry it with you at all times in case of an emergency, and a doctor needing to know that you are on warfarin and at what dose. Okay. And you will need a regular follow-up and regular blood test. Yes, this is the same. You look at it, yes. Okay, as you say, Dr. Henry, the extent of which warfarin is working is measured by the international normalized ratio. It is a test, okay? which is a measure of the ability of your blood to prevent clotting. Okay. The amount of warfarin that you need to take will depend upon the result of these blood tests. And this is why your dose may change from time to time. Okay. And the aim is to get the dose of warfarin just right, so your blood does not clot as easily as normal, but not so much as to cause bleeding problems. So we need not to be clot or bleed. Okay. So you will need to follow up in a special clinic called anticoagulation clinic. Okay, in which you can check your blood thinning value to keep it within the target range and the dose of warfarin adjusted. Okay. This is the first step. Okay. We talked about the importance, the disadvantage, and how to overcome this disadvantage by follow-up. Okay. After that, about special advices. The most important advices for warfarin. The first is about the new medication. New medication, if you buy any medicines, check with a pharmacist that they are safe to take with warfarin. Or for example, you should not take some painkillers such as aspirin and other anti-inflammatory painkillers, because she also in aspirin for antiphospholipid syndrome. So she need to stop aspirin. And some vitamin and herbal preparation will you are while you are on warfarin. If you need to take painkiller, you may take paracetamol, but you should let your doctor know if you need to take it regular. This is the first advice. The second advice about the diet. So you need to say changing your diet suddenly can affect your INR. Okay, especially if you begin to eat more vegetables and salad. You should not begin a weight reducing diet without discussing it with your doctor first. And a major change in diet may mean that you need closer monitoring and may need a change in warfarin dose. Okay. So you can also ask about if you missed the social, because there is more concerns with the patient, you missed the social history. About alcohol and smoking also you need to talk. You should advise her about stopping alcohol, or only she can drink alcohol in small amounts, as this can affect the levels of warfarin in your or in her body. Okay, so limit the amount of alcohol that you drink to a maximum of 1 or 2 units in any day, and never binge drink. Also about drinking cranberry juice, because it can interfere with warfarin and affect your INR. So it is best to if you avoid cranberry juice. Okay, I will also refer you to a dietitian to give you a list of types of food you have to avoid. This about the second advice about diet. Okay, about sports and activities. Okay, avoid activities that could cause you to cut or bruise yourself, such as contact sports, because warfarin is used to prevent blood clots from forming. You should try to let your doctor know if you have any falls or injuries. This is the fourth advice. The fifth advice about surgery or injections. If you are due to have any injections or any medical or dental treatment, tell the person carrying out the treatment that you are taking warfarin and show them your anticoagulant Unicard or anticoagulant booklet. If you are due to have surgery, you may be advised by the clinic to stop taking warfarin for a few days before the surgery. Okay, this is a advice about the pregnancy, and she is concerned. One of the concerns of the patient. You will say you should advise. You should avoid getting pregnant. Okay, please can mute. Okay.
Okay, go
You
ahead,
should.
Dr. Hani.
Okay, you should avoid getting pregnant while you are taking warfarin, which can be harmful to baby. And make sure you have discussed with your doctor which types of contraception are suitable for you and your partner. But if you want to be pregnant, if the patient is planning for pregnancy, so you will say during a pregnancy, you will we will exchange warfarin with another thinner medication given under the skin, which save during pregnancy. So if she planning for pregnancy, yes, no problem, but we will change warfarin with another, if you get pregnant, with another medication or injections. Okay. About her concern about the doses of warfarin. So you can say warfarin tablets are available in different strengths. Your dose may be made up of more than one strength of tablet. Each strength of tablet is different, is a different color to help you tell the difference between them. Okay. If you forget to take a dose, take it as soon as you remember. If you forget to take a dose, take it as soon as you remember. If you don't remember until the following day, skip the missed dose. Okay? And don't take two doses together to make up for a forgotten dose. Don't take two doses together to make up for a forgotten dose. And remember to let your doctor know about any missed doses when you next have your blood test. And continue to take warfarin tablets regularly until your doctor tells you to stop. Okay. Okay. About you can also about the doses. Also, you can say never take more than the prescribed dose. Take warfarin exactly as you have been advised by your doctor or anticoagulant clinic. You should aim to take warfarin at the same time each day, because this will help keep the levels of warfarin in your body steady. Okay. That's about the doses and missing doses. Okay. If you suspect that you might take an overdose of this medicine, go to the accident and emergency department of your local hospital. This is about the most important points and answering about the patient concern. Okay. Okay, Dr. Bassem, you can comment if you want.
Yes, thank you, Dr. Hani. Sorry. You prepared the topic very well. You explain all the details and any possible concern related to the warfarin in the basis exam. But how you can expect the scenario and what to cover. So either you will have points as a scheme to follow, you have to mention, or you will follow sorry, concern by concern address. So either the surrogate will give you concerns in these points, as Dr. Hani mentioned, and you will answer them one by one. And according to your answer, you will get the marks. Or you will start to explain, and in between, he might give you some concern, but you have to cover the most important points. But to cover all these concerns, it's impossible. It's 10 minutes only. You cannot cover all these concerns. So, what are the important points to be discussed, and what are the concern would be added as extra concern, which is not classically covered by the candidate? Let's start as usual. If you are stuck and you don't know what to do with any scenario after the introduction and you are going to explain a medication, you have 4 items to fulfill. The dose, here you cannot say exact dose. So we will start with the number of the dose. The blood doctor or the consultant or the team will be detected for you. Then we will follow up you frequently and regularly to reach to a target number of blood thinning, which we call it INR clinic, and regularly you will follow up. This is the first point you have to talk about. So the point I will mention now, they will be the important point to be discussed or raised by you. The second point, how I will take the medication, you will take it by your mouth. So we are talking about the route, the dose, the frequency. So you will take it once daily, you will take it through your mouth, and the dose will be detected by the consultant. This is as a pharmacokinetic. The simple and the most simple information about any medication you have to remember. Okay. What other point you can raise and to discuss with the patient? The possible common side effect. And whenever you mention the side effect, you have to mention also the compliance and the importance of compliance. So I have side effect related to the extra dose or repeated dose or recurrent dose or extra dose. And I have also complication related to missed dose, which is the compliance. I have to talk about it. If you miss a dose, you might be liable for another clot. And unfortunately, I'm afraid to say, maybe it will be life threatening. You have to warn the patient, this is very important. The compliance, as well as not to be exceeding the dose or taking it in extra. So in two ways, either missed or extra, or side effects related to interaction. So the missed will lead to clotting, thrombosis, and the extra or the side effects, your blood might be more thin and you might have bleeding. So these 2 points should be explained to any patient with will start on any medication. So you have to be compliant, and if you are not compliant, you might have the complication. Or if there is interaction or the drug itself might be exceeding the limit, and you might have thinning, and your blood will be more thinner, and you might have bleeding. So in those 2 ways, you explained two complication, which is very important. The next thing you will discuss. So we finish most important. This is the most important thing you have to discuss. What will be discussed will be related to the social. What I mentioned is pharmacokinetic. Okay, the dosage, the frequency, and the route, the possible side effect, and the very common side effect, the importance of compliance. All of these must be explained. It will take 3 minutes. This is the main task. Now we'll talk about extra concerns. The pregnancy, the social first. I'm planning to have pregnancy. Refer immediately to a woman doctor to have planned pregnancy. And it will adjust the dose or it will be switched to injectable medication. What else? The social, smoking, alcohol, very important. Why? Because there is interaction, the alcohol and the smoking. What else? As Dr. Hani mentioned, drug interaction. The card. You have to carry the card that you are on medication. And the precaution. Be careful or cautious with some sport exercise or exercise or heavy exercise or contact sports. And the last point is the exercise, and the risky hobbies. Take care and be careful about this. Okay? This is the most important as a must. The extra questions or extra concern might be raised by the surrogate will be to get the full mark or complementary to the scenario. But you cannot remember all the concern Dr. Hani mentioned. But Dr. Hani give it as idea, just remind all of you how to address these concerns. But believe me, 10 minutes, of course, not full 10 minutes. It's 8 or 7 minutes in between the introduction and the closure. You cannot cover all the things, but at least know what to address and how to address if he raised or the surrogate raised it as a concern. I hope it's clear. I don't want to repeat the whole talk, but I'm talking about how and what to be raised by you and what to be discussed and addressed as a concern. At the end, as Dr. Henry said, leaflet brochure is very important. Team will follow you. Diet, also the diet important to be raised with the drug interaction or diet. You have to have the diet instruction from the dietary specialist. This is the point, the most important point, as I said. The pharmacokinetic are very important, not in details, but simple talk. The route, frequency, dosage, possible and very common side effect. I hope it's clear for all. Regarding Dr. Henry performance, clinical communication, I think he covered most of the important, but I think, yeah, he missed the social history. Be sure you are covering the social history in the communication. He addressed the pregnancy well, so the clinical judgment was perfect, satisfactory. The clinical communication, he missed the social, so he might have marked down in the clinical communication. Concerns as well were covered well, and the welfare also was good, since he gave advice regarding he didn't give advice regarding hobbies and sports, right? This is one of the welfare points, so it will be also borderline. Okay. Any question or concern? Any comment?
Dr. Bassem, just like mashallah, wallahi, both of you did a very great job. But just as a reminder, since we are talking about drugs and compliance, always before you mention the side effect and start enumerating by yourself, the most expected concern that I don't want to take this drug, or at least ask the patient if he know anything about this medication and he has faced any trouble himself or someone he knows. Because sometimes when you start just talking, and you are not triggering the concerns of the candidate. So especially when you talk about the side effect, when you start talking about the risk of the medication, trigger the patient whether he have any bad experience with the medication. It will reveal any hidden concern, and at the same time, it will appear like you are engaging the candidate in your discussion. And I like too much the idea when you mentioned that whenever you explain the side effect, divide them. For example, in steroid, there are the short-term side effect and long-term side effect. Whenever we talk about blood thinning medication, there are also the overdose side effect and the underdose side effect. And whenever you talk about the side effect, always try to keep the critical serious one than the less serious one. So don't just enumerate haphazardly, because this will help the patient to agree whether to take the medication or not. And try to offer the solution for the most serious. Like when you will mention that the warfarin side effect is bleeding, okay, and even it can happen with a low INR or high INR. Bleeding can happen at any time, especially if he took some, like if he took it, if there was any drug interaction or any like extra factor which make him bleed. So tell him that it's we can manage it and there are reversing agents available. So please, just you have to come and inform to come to the ER immediately. And the same thing for the red flags. Always divide the red flags, something for the medication and something for the condition itself. She has an APLA, so she might have another PE. So you have really to tell her that at any time you experience the similar symptoms to what happened with you when you get the clot in the lung, or you feel any other new onset symptoms, or you had any bleeding, or whatsoever, a new headache, like head and bleeding. Usually it present with headache or present with vision changes, which is not an obvious bleeding to the patient, or black stool. So those things which usually not connected in the mind of the patient to bleeding, try to enumerate them, while other kind of bleeding, it's easily for the patient to pick up. Like if he bleed from his nose or the gum, he will find and he will knew immediately that he's a bleeder. So those red flags also need to be divided. The side effect need to be divided. It will help too much to make your consultation like appear very well constructed, and try to engage the patient himself, especially when it comes to the side effects. And one thing, I don't know if you people started your discussion before going into warfarin, that why warfarin is important for APLS. That APLS is a condition which drives too much the risk of clot formation. It makes the blood thick, and there is a kind of substance which is formed inside the blood, make it more liable to form a clot. So in order to save you from this complication, we need to make the blood thinner, because sometimes explaining the connection between the medication and the disease, it helps to convince the patient that this medication is very important, and being compliant is also very important. So those points only. Otherwise, really thanks. It was a very nice revision for warfarin and anticoagulation in general.
Perfect. Thank you, Dr. Hint. By the way, I like when Dr. Henry asked the patient or the surrogate, anyone explained to you about your condition? And the surrogate said yes. So he didn't go through it. And he started the task immediately about warfarin and counseling for warfarin.
Yeah, I agree with you. And
Yeah.
she should not repeat. But since
Yes,
you are trying to talk about a blood thinner,
exactly.
at least يعني hint that this blood thinner will help to avoid a complication
Yeah, he
related
mentioned
to your
it. He
underlying
mentioned.
condition, as a
Mhm.
part of explaining the benefit why I'm giving you this medication.
Yeah, he mentioned it, not to have another
That's it.
clot.
Like, and I
Yeah.
agree with you. Repeating, explaining the disease, or like taking APLAS and explaining APLAS as a part of the consultation. خلاص, the patient, as you said, I know very well about my condition, and at
Yes.
least also it's not important to tell him when APLAS has get complicated by pulmonary embolism. Those you can skip, but what part of explaining the benefit of the medication, you might need to touch this just as a part of benefit, explaining
Yeah, as a
why.
mechanism of action, yes. So the mechanism of action, which is one of the pharmacokinetic I missed, yes. So
And
the mechanism,
connect it to the pathology, I mean, to
exactly,
make
yes.
things easy for the patient in his mind, that I have this condition, it increases risk of clot, I need a blood thinner. Okay,
Perfect, yes.
get me? Yeah, that's it.
Yes, I get it. So one of the important point to be added to the pharmacokinetic, as Dr. Hind mentioned, and I did it in the short video before, the mechanism of action, why I take this medication, because it make the blood thinner than usual, because my blood already thick, and the effect of this medicine will help not to have another blood clot. A very important point. Thank you, Dr. Hind. I will add one concern for Dr. Henry, because this concern might be raised by the surrogate, and it will be one of the complementary concerns. Dr. Henry, I read about Dr. Henry as the surrogate. Doctor, I read about a medication called NOAC or DUAC, and I know one of my cousin, she is taking this medicine as a blood thinner. Can I take this medicine, doctor? How to address it?
Thank you. Your concern is valid. Actually, these drugs you mentioned are also blood thinners themselves. However, in your own case, the warfarin has been shown to be of more benefits than the medicine you just mentioned.
Okay, this is one of the answer, but what the optimum one?
Um,
You want to say, okay, this is okay, the warfarin is the best interest, okay, you have to say the best interest of your condition. But
yes.
is it alternative?
Your question is valid. Actually, it's in this case. It has been shown that the DOAC, which is the medicine that your cousin or your sister is currently taking, has not been shown to be effective in your condition, known as the
Perfect.
syndrome that you have.
So this is the best and the optimum answer. It's not suitable to your condition, right? It will not have any effect in your condition, or it's not suitable in your condition. Maybe your cousin have another condition, but in your condition, it will not be suitable for you. Okay, this medicine, and you have to appreciate sharing this information. I appreciate sharing this information with me, and thanks, and so on. Then, unfortunately, or I'm afraid to say, this medicine is not suitable to your condition, and in the best interest of your condition, the warfarin was prescribed by the consultant to you. Okay, Dr. Hani, your scenario in the chat box.
Okay.
Counseling a patient with infective endocarditis. You are waiting outside the room. You are the medical registrar on the ward. Patient, Mr. Ahmed, 52 years old, has been admitted with fever, fatigue, night sweats. Investigation showed blood culture positive for Staphylococcus aureus. Echocardiography show also infection on the mitral valve. He has been diagnosed with infective endocarditis. Your task to counsel the patient about the diagnosis, treatment plan, possible complication, answer the concern. Regarding the concern, as Dr. Hind said, don't be a machine to repeat the information without stopping and asking, does that make sense for you? Any concern? Anything worrying you? Not only to start to talk without listening to the patient. It's a conversative way, not as one-way discussion. So whenever you are giving information, stop, ask for following, and ask for anything concerning or anything worrying. Or does that make sense for you? Through the whole scenario. Either the surrogate will give you a concern related to your talk, sorry, or the surrogate will give a concern he want to give to you to give you a mark. So if you didn't give him the time to raise this concern, you will lose the mark. And he's helping you. If he stopped you to give you a concern, don't be irritated. He want to give you a mark. And he's instructed to give you a concern, which is very necessary for him, while the thing you are saying may be unnecessary. Okay? So be careful. Don't be always talking. Don't be a machine. Be a listener rather than being a talking one.
And like just two things we usually forget in the social. One of them will raise a good concern rather than enumerating, don't use sharp object, don't. You can ask him about his job because in many of the anticoagulation scenarios, the job will be mechanical engineering. So he will use like some heavy tools, or he will be a chef and he's like using knife and cutting tools. So just don't forget that social, we always concentrate on smoking and alcohol. So habits or like heavy sports will be asked under the category of habits. Any heavy sports, any special habits you have, and this will be part of the judgment if you stop him from any dangerous activity. And also, when you ask him about his job, if he's using any sharp objects. So at the same time, so as if you are using all those good concerns Dr. Hani mentioned, you are dividing them on the categories of our routine consultation. So part of our social is to ask about the impact also. Always don't forget this patient have been newly diagnosed with APLS, had a PE, will be on an anticoagulation. So just ask him anything in your life, had it been changed, any impact on your daily life activity you'd like to share with me, just as a part of the marking sheet where they will mark you if you assess the impact or not, plus the job and hobbies. So it will be a good thing rather than enumerating regarding warfarin to ask about those things. And thank you so much for the case.
Yeah, thank you, Dr. Hind. The job, very important point related to the social. Yes, it must be raised also in any scenario, not on our today's scenario. Not only the job, as Dr. Hind mentioned, the job plus the impact either on the job or the daily activity. So might be the patient is retired. So what be the question? Is it affected your daily activity? Or if he's working, whatever the job, it might be also there is impact. So you have to know if there is impact on his job. So either the job itself, if he's not working, the impact on the daily activity. But the impact must be asked either to the job or the daily activity. Thanks so much, Dr. Hint. I think we cover everything related to this scenario, the warfarin and the APLA pulmonary embolism. Now we can move to the next scenario. Dr. Hani, you ready?
Yes.
Okay, here you go.
Hello there.
Hello, doctor.
I'm Dr. Abu Hafiz, the doctor in the clinic today. Can I confirm that I'm talking to Mr. Ahmed and you are 52 years old?
Yes, doctor.
Okay, nice to meet you, Mr. Ahmed. Mr. Ahmed, I am here today to discuss your condition. Is it okay with you?
Okay, doctor. It's okay.
Okay. How are you feeling today, Mr. Ahmed?
Doctor, I'm still having, hotness of the body and a little bit of weakness, doctor.
Okay, I'm sorry for that. So before we start to discuss your health condition, Mr. Ahmed, and to be on the same page, can you tell me more about what you know about your health condition?
Yes, doctor. Doctor, actually, I've been having this fever, feeling weak, and sometimes I sweat during the night for a very long time now. So I came in and I saw a doctor. He gave me some tests to do. I did some tests, both blood tests and picture. A jelly scan was applied to my chest, and they viewed my heart on on a TV on the monitor. And I've been waiting to know the outcome, doctor, to know what they've found out that is wrong with me.
Okay, I appreciate your knowledge, Mr. Ahmed, and I am sorry for what happened to you, and be sure that I am here today to support you, okay? And I will do my best to help you today.
Thank
So,
you, doctor. Thank you.
Mr. Ahmed, from your blood test and heart scan, we found that you have a condition called infective endocarditis. Do you ever heard about this condition before?
Not at all. Not at all, doctor. I haven't. What is it all about, doctor?
Yes, I'm sorry to tell you that this means there is a bacteria in the blood have attached to one of your heart gates or valves. So to simplify this condition, I will draw to you. I will draw the heart. This is your heart formed from 4 chambers. Okay, and this is 4 chambers, and every between every 2 chambers is gates or valves in medical term. Okay, and the blood is pumped through these chambers. There is an infection by bacteria transferred to the bloodstream through the heart and attached to the valve or the gate. One of the valves is called mitral valve, or so this infection attached to this valve and cause this problem you have. Does it make sense for you?
Okay, it doesn't make sense to me. It does not make sense. You mentioned bacteria, you mentioned mitral valve, you mentioned what? But what I'm just picturing in my mind, like in your diagram, you just drew to me that most likely, okay, is it this valve that is what connects the upper one and the lower chambers together, right? That is what is affected. That's why you say bacteria. What is bacteria, doctor? What is that? Is that
I
an
mean,
infection?
I mean germs. The germs.
Germs. Oh, okay.
Yes.
Okay. So there are germs there. Oh, okay. Okay.
Yes. Sorry for this medical term. I mean by bacteria is the germs which transfer to the attached to one of the gates inside your heart.
Oh
Is
no!
it
So,
clear?
doctor, is it is it life threatening? Am I going to die from it, doctor?
I am sorry to tell you, it is yes, it is a serious infection, but with treatment and early, we discovered it early, and with treatment, it will improve.
Oh, okay.
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 Yes,
But
sometimes.
doctor,
Okay.
no, go ahead, doctor. Go ahead.
Okay, so sometimes bacteria can enter the bloodstream through infection in other parts of the body. You may be there is a question in your head from where this infection come. So maybe from another part of the body, from teeth problem or skin infection or even other medical procedure. Okay. So what we will do now to treat you, Mr. Ahmed, we will admit you in the hospital. And the good news that we diagnose this infection yearly, and we will start the antibiotics given through blood channels, okay, and monitor you closely, okay, and maybe this antibiotics will take maybe 4 to 6 weeks to completely clear this infection from your heart. Are you following me, Mr. Ahmed?
Doctor, do you mean I'm going to be in the hospital for 4 to 6 weeks?
Yes, I am sorry to tell that. I know it is a long duration, actually.
Doctor, it's impossible. I can't. 4 to 6 weeks, I should be in the hospital just to be taking injection?
Yes, it is understandable, your concern and valid, Mr. Ahmed. But initially, yes, we keep you in the hospital to monitor you, your response to treatment, and make sure the infection is improving. In some cases, once the patient is stable, maybe you can, part of this treatment may continue at home with close follow-up. How does it sense?
Doctor, it doesn't sound funny at all. I can't stay in the hospital for 4 to 6 weeks. I can't.
I highly appreciate your concern, Mr. Ahmed. Can you tell me why?
Doctor, I'm the only one here. Two of my dogs and my cats are at home. Nobody to take care of them.
I highly appreciate your concern, and I appreciate your kind heart about these animals. So we can call our social workers to help you on this issue about feeding your cats or your dogs. Is it okay with you?
Okay, well, that would be nice.
Okay.
That would be nice.
So,
but still, doctor, I don't think I'm going to stay for 4 to 6 weeks. I'm sorry.
okay. So, do you have any problem in staying in hospital other than your
Yes.
your?
I don't like the food. Yeah, I don't that the kind of food.
2 minutes left.
Yeah, I don't like the food they prepare in this hospital, doctor.
Oh, okay, I can talk to the chef in charge to discuss this food with you. Which food type food you prefer, and he can help you in this issue.
Okay, no problem. And since you've agreed to take care of my dogs and my cats, and then change the meals, no problem. Okay, it's all right, doctor. Okay.
Do you have any other concern?
Yeah, doctor. Will this condition will it happen again?
Sorry.
Will this condition, this what you call infective endocarditis, will it reoccur again after treatment? Can it reoccur again?
Maybe this happened if you exposed to infection. Maybe happened. Okay, but we will monitor you closely to this infection not come again. Okay.
Okay, so it means after treatment it will not come again. Oh, that's good. That's good.
Can I ask you some question, please?
Yeah, go ahead, doctor. Go ahead.
Okay, what are you doing for a living?
Doctor, I'm a security officer.
Okay, and okay, are you supported financially, supported in the home?
Yeah, I just have me. I live with my two dogs. They're my guide. I work with them. You know.
Okay,
Yeah.
okay. So do you smoke?
No, I don't.
Do you drink alcohol?
Alcohol, no, I don't drink alcohol, doctor.
Okay. So I will give you some brochures and leaflets to read more about this infection, endocarditis. And I will give you the contact number of our department if you have any queries or questions after discharge. I mean, don't hesitate to call us.
Thank you very much.
Okay, time is up. Thank you, Dr. Hani. Well done. Dr. Henry, you can comment now.
Yeah, thank you very much, Dr. Hani. That's a brilliant one. You started the introduction very well. You asked of my knowledge, and I told you at the same time you acknowledge that, and then you proceed. But your first point you started with, which is you did very well by drawing the diagram. That alone, gives you an additional point in my scheme here. You did very well to have drawn the diagram. It makes me to be part of the management plan. And then you mentioned jargons 2 to 3 times, and that's what tends to affect your mark, to be candid. Those jargons you mentioned, you asked even after apologizing for the jargon, you should mention it again. So about 2 to 3 times you keep on mentioning bacteria. So to me, I consider that as a jargon to my own part. And then your task, you didn't complete your task. Possible complication. Do you talk about possible complication?
No, but actually there is no time.
So you talk about the diagnosis one, you talk about the treatment plan, which is also good. You answer some of my concern, which is good. But the one of the tasks, which is so that also gives you borderline in terms of because of possible complication, which is you didn't talk about possible complication, safety netting. After possible complication, the patient has agreed. You've convinced the patient to stay, which is a good one. You answered, you are able to convince him to stay. That is a plus to your own side. However, following treatment, you should tell him the complication about, it can cause heart failure, it can cause, it can embolize, it can cause stroke, it can cause kidney problem, a lot of complications it can cause that you are supposed to tell him. And then safety net, if following condition. And then one of the things you didn't really address, one of his concerns, when he asked about reoccurrence, you said that you treat it and hopefully it will not come back again. That was a fallacy. Because infective endocarditis can reoccur even after treatment. In fact, one of the risk factors, the commonest cause of infective endocarditis is previous infective endocarditis. If it happened before, it can happen again. So that concern was not addressed properly. So that is another part that should have really addressed.
Yes, actually, I must. When he said, "I want to know, stay in hospital," I must enter the complication here in this issue. But I prefer to ask about why he will not want to stay in the hospital firstly, but must say in the complication in this position, especially.
Yes, and I think the one when you should have talked about the complication is when he asks you, is it life-threatening? That was the point.
Yes.
The point you should have quickly talk about the complication, sharply, because he gave you a leeway to talk about the complication by asking you, doctor, is this condition life-threatening? At that point in time, you should have used that point to talk about the complication. I don't know if that is clear, Dr. Hani. That should have been the best part to talk about the complication. So, and okay, I think these are some other things that you spoke about my social, which was okay. You asked about, I think you give me leaflets, you check my understanding, which yes, you check my understanding. Safety netting, not so much. I think these are my comments as regards to it's a very common case. It has come out, several times, diet one, and also in previous diets. So I think I'll leave it to Dr. Bazin to throw more light on it. Thank you very much.
Okay,
Dr.
thank you, Dr. Henry. So, based on the skills, what about the clinical communication?
Yeah, the clear communication, he did well. At least he was able to communicate well to me.
Okay.
So at that point, but like I said, there's some parts that was the jargons he spoke tend to bring the communication down because of the
Mhm.
jargons that even borderline.
Not
Because
only
of
the
because
jargons, even the complication, as you said,
yeah,
wasn't explained yet or properly. Okay. So still,
yeah,
it can be as marked down in the clinical communication. Clinical judgment, he answer the concern
yeah.
appropriately.
He answered the concern, except one of the concern that I didn't address very well, which is the issue of can this condition reoccur again? That's yes, it can. He didn't tell me that. He didn't give me that. He didn't tell me that it can reoccur again. He only told me that once it's after treatment, it is gone for good. He should have told me about even after treatment, this disease it can come back, it can reoccur. Yes, he should have let me know, because that question was not properly answered, Dr. Basil.
Yeah.
That's the only
Yeah.
concern that wasn't properly answered. The other concern was given
Okay.
was answered very well.
We'll postpone this to the concern skill. But the clinical judgment, the all points as a clinical,
Yeah, it was addressed.
yeah, so it
Mm,
was
mm,
answered
mm.
properly.
Yeah,
This is as a factor. Even when he asked to go home, he
yes,
addressed why,
he
and he
did job.
said,
He did well. Yeah,
yeah, if the compliance is good, the response is good, we can follow up with the medication at home with the
yeah,
nurse or home care nurse. Okay. The next will be the concern. As you said, there is two concern, not only that this one. Will I die, doctor? It was one of the hidden concerns that the patient or the surrogate asked in between, but I think Dr. Hani didn't answer it. So if we ask the question again, Dr. Hani, will I die, doctor? What you will answer?
Yes, we can. Yes, it is a serious condition, but we can't expect the time of death or like that.
Oh
We
my
will do
God.
our best. Okay, just let me. Okay, we will
You will
do.
say to him immediately yes, and it's
I mean, it is a serious condition. If
yeah, but don't say in this way, yes, you will die or you might die. You have to prepare the patient. You
uh,
got it?
uh,
Yeah, I'm so
the
sorry to
question,
feel that. Yes, I'm so
just
sorry to
just
feel that.
just just let
Okay,
me to
okay, go
explain.
ahead. Yes, okay, Dr. Hani, go ahead. Sorry.
Her question, it was, is it a serious condition? And I will, when I will be die. Yes, it is for yes about the
Okay,
question
it
about
was about the
if it
serious.
is
Okay, okay,
yes, yes. Uh,
okay. I
yes, it is a
misunderstood it.
serious
Okay,
condition,
okay,
but with treatment we can clear this infection. But
perfect.
about the time death, we can't expect that.
No, no. Most of the patient will be recovered. So if we give the
Yes.
medication properly and regularly with good follow-up, you might be okay. Yes, there is possibility whenever you missed or you didn't take the medication or you are not compliant or you left the hospital or the infection spread, there is a possibility and there is mortality, yes, as a clinical judgment. But most of the patient will be recovered after taking the course of antibiotics. Okay, so be careful about every concern. Don't answer two concern in one concern. If he asks about serious, yes, it's serious. Will I die, doctor? You have to prepare for this question, and not only in this scenario, every scenario. I'm so sorry to feel that or to feel like that, and I'm afraid to say any condition in such condition, the condition, if you don't take the medication properly, yes, it might threat your life. So don't say, yeah, you might die. Okay, say it in a good way. Yeah, it might threat or harm your life. Okay.
Okay. Okay.
Okay. So this is regarding the concern. Still, one of the skills will be having marked down. The last one was welfare. I think he asked the patient to be admitted, and he didn't agree to
Yes.
let the patient go home. So this is also
Yeah.
was maintained as a welfare
Yeah.
point of view.
Satisfactory.
Yeah, satisfactory. Okay. Any question or comment, Dr. Henry, you want to add?
Not too much. I think you've is a common scenario in PACEs, and I
Yeah,
think that's he has done justice to it. The other part, we've made some point out the corrections. Thank you.
perfect. The way to draw Dr. Hani was perfect.
Yeah.
It's easy explain and explanation way. So be sure that whenever you have a condition, you can draw it. The surrogate will be paying attention, and also he can understand easily. But avoid the jargon. I noticed, Dr. Hani, you are repeating bacteria, not in this today's scenario, maybe multiple scenario before. Bacteria, either to say it's a bug or a germ. Okay, bug or germ.
Yes.
Use
Okay.
this word. Yeah, try to train yourself to say it as a habit. So you have infection with a bug,
The
and you have
virus
to
is not
mention
jargon.
the name. Sorry,
The virus is not a germ.
virus, and again say it as a bug or germ. But the virus is supposed to be known as a common word, so you can say it. But even you can say another term, which is simple term. It's a bug or a germ also, which also affect or invade your body or enter your body through some of the infection area, as you said in this scenario. What I want to say also regarding the bug, the chamber, yeah, the gate, the infection, the drawing, yeah, the area of entry, yeah, the bacteria. You can explain to him the name of the bacteria. Once it was written in the scenario, so you have to mention it to the patient. So you have a bug called Staphylococcus aureus. What the importance of explaining or telling the patient about the name, Dr. Hani? Is it
Uh,
important to
uh,
say?
Actually, from my opinion, it is not important. He is scared from the name of bacteria only.
Yeah, but it's yeah, it makes sense to mention to the patient, or either he will ask you, doctor, what is this infection, or you can tell him. Why I will tell him? Because this patient should know about the bug itself. He might read about it. He should know that it's very infectious one. It's very potent and powerful and violent or bug that can lead to his death or his threatening his life. Staphylococcus aureus as infection is not easy to treat. Some patient, if they have miss or lack of dose, it might be more resistant. As we know and everyone knows, any patient with the Staphylococcus aureus, it might be methicillin resistant. It will be more potent bacteria. So we have to give the patient name. He might read about it. By the way, nowadays, most of the people and patients are either well educated or they are easily searching about what they have and they know everything and they can read the culture. They can ask the AI, they can use the ChatGPT, they can search about it, they can read about it. Okay, nowadays the people are more oriented and they are careful to know what they have in details. So you can tell him even in one time as a name. You have a bug called Staphylococcus aureus. Don't bother about the name. And if ask again, you can tell him once only. What the importance, as I said, it's potent one, it's potent bug. We have to treat it seriously. Otherwise, this bacteria will be more resistant to the medication, and next time will be difficult to treat. And this is a true, right? Then, what else I want to mention? Yes, this is my comment regarding this case scenario. Any comment from others or question?
Simple addition.
Yes, Dr. Held,
In
of course.
infective endocarditis scenarios and HIV, I always want you people to add just like one extra category to be discussed while explaining the disease is the risk factors. So here in the scenarios, you need to tell him especially that the point Dr. Henry raised, that this disease can happen again. So by saying that anything can happen again, I should explain what we shouldn't do in order for this disease not to happen again. And in between two brackets, those are the risk factors. So simply you can tell him taking care of your dental hygiene and avoid needle sharing for any reason. If you had any surgery in the past of your heart, if you had any abnormality in the heart, whether in the adulthood or childhood, all these things put you at risk of having this condition and might even put you at risk in the future for having a recurrence of this condition. That's why if you had any of those risk factors, please let me know in order not to ask any history. And immediately after this, the role of prophylaxis should come. At any time you get an infective endocarditis patient, he should know that he should inform his doctor before any procedure in order to be given the proper antibiotic if there is a compelling indication. Otherwise, if this information was not given, he will not tell about this past medical history and he might go into a complication. So you should inform him that since you had this attack once, there are some procedure which we need to give you an anti-bug infection before carrying out those procedures, or we will put you at risk of having this again. So that's why please be careful to inform any healthcare provider that you had this condition in the past. So along with the risk factors, what will be associated with this condition for his long term, for his life, he had to take care of giving this information to his doctors. The second thing, this scenario is a very important scenario after they invented the OPAT, which is the outpatient parenteral therapy, and the ambulatory care. So they want to introduce this new modality in the community. And also for us as a people who might go and work in UK in the future, that now there is no need for long-term admission of any patient just for IV medication. This indication alone is not anymore an indication to keep a patient occupying a bed in a hospital. But we have to be very careful that in infective endocarditis, I'm not keeping the patient only or purely for this IV medication only. I need to monitor his inflammatory markers. I need to make sure that he is not at any point of time there will be an impending complication about to happen. Because as you mentioned, all those things will remind you to talk about the complication. I need to tell him I cannot discharge you because there are many reasons. One of them is that you are on an IV medication, but this we can solve it by training you to take the medication by yourself or by assigning you to any nearby ambulatory care, especially if he can go to that ambulatory care. Send the nurse to home is a service which is provided to limited population who are elderly, frail, they cannot go outside, any reason which might make them unable to go outside their home and approach the ambulatory care to take the IV medication. So for this patient, he's ambulatory, he's young. And I think how old is he? 70? No, 52. So he's young. So he can go to any nearby ambulatory care and he can take his IV medication, or we can teach him how to do this at home through the OPAT education or training nurse. And we will fix for him a PICC line, and he will inject fixed pre-filled ampoules containing the antibiotic into the PICC line. And after 6 weeks, he will come back and we will remove the PICC line. As easy as that, yani, especially if he can do this by himself. So just you can introduce this very simply to him, that now we have what we call OPAT, what we call OPAT, and it's a kind of a training thing. We can offer it to you to take the medication by yourself at home if you are willing, or we can assign you to a nearby ambulatory care to go and take your IV. But there are more concerning reasons for me to keep you in the hospital. Monitoring your some markers in the blood, which show us how much you are responding to our antibiotic, and to keep an eye whether we need to change those antibiotic or modify the doses and those kind of stuff, which is important to achieve a fast resolution of your symptom. Third thing is to monitor you for any impending complication. And at any time we feel that you are at a risk of any complication in your condition, intervening early give better outcome. While if you were outside the hospital and you developed any complication, we lose the golden hours to achieve a good outcome. So by this, you are convincing him to stay. If he continue to be reluctant, you will give him you will tell him that I would like to arrange for you a meeting with my consultant. He might be in a better position. And I would like to discuss with you some red flags because you have to be very vigilant, too much vigilant about your condition. At any time you had a recurrent fever, fatigue, any kind of awareness of your heartbeat, you need to come immediately to the hospital. Or at any time you feel your leg are getting swollen or you had a shortness of breath, which is the heart failure symptoms. So you had to come back immediately. And after the meeting with the consultant, we will check if you are convinced, we will continue. If not, we can activate the OPAT training and assign you with a nurse who will teach you. Or with the ambulatory care unit we talked about. So you had to have some flexibility when talking about infective endocarditis scenarios because they have a lot of variety and like they are all, let's say, difficult scenarios. Sometimes they tell you he's a needle sharing and you have to address the IV drug abusing and the what we call them, the addiction program, and ask him to stop. And this will be an additional task. Sometimes he's requesting discharge. So you have to offer him the IV drug services outside the hospitals. And sometimes it is related to some prophylaxis and antibiotics, which you need always to take before any procedure. So all these things, you have to keep them in your mind because they brought this scenario in order to see how you will address those points. And thank you so much. I'm sorry if I made it lengthy.
No, it's too much, Precious. Thank you, Dr. Hen. Valuable comment as usual. I want to add to your comment that not every scenario will be driven as you wish. So you cannot drive the scenario as you wish. Sometimes they have interrupted concerns in between your talk. You have to fulfill these concerns to get your full mark or to get the skills marks. So yes, you will try to do as much as you can, but sometimes the patient or the surrogate will take you to the point instructed by the examiner to ask you and to judge on your performance and your answer about these concerns. So be sure that if he asked you, don't be angry. Let him ask, let him interrupt you because he has this instruction and he should follow. As Dr. Hind said, it will be as the instruction of the scenario according to the examiner instruction. Maybe this scenario will be raised today for the point of IV drug abuse. And I will add also to this point in particular, the tricuspid regurg infective endocarditis. So here, whenever you have tricuspid regurg infective endocarditis, you have to get and to analyze or at least to address the point of IV drug abuse. Today's scenario about mitral, so the risk will not be as compared to the right side or the tricuspid valve, will be not related directly to the drug abuse. But whenever you have tricuspid, remember the drug abuse or IV injection or sharing needles as a risk factor. I think Dr. Hani also addressed the point of the entrance of the organism or the bug. It came as from the dental or from surgery or whatever. But I want to add also, as Dr. Hind mentioned, the prophylaxis, because we have discussed this point, Dr. Hind, a couple of days ago, the prophylaxis of infective endocarditis as updated. Nowadays, they are not giving the prophylaxis in any condition. They are giving it in only certain condition, like previous infective endocarditis or congenital heart disease.
I mean,
Question.
Complications, yes, بس يعني
Perfect.
يعني even when you will tell him that for some procedures and for some, because at this point you cannot understand whether he had any surgery, whether he had a childhood rheumatoid fever, rheumatic fever. So
Perfect.
you don't have enough information, but at least just emphasize that some conditions the patient he need to know. And I like too much the idea of that you mentioned that he should know the bug, because later on they will give him the antibiotic based on the previous bug. It will guide the antibiotic choice. So the
Perfect.
patient should be educated about the information and written. Even you can, once it made a big change for us. One patient, he had an infective endocarditis, and later on she came with discitis, and it was all about the strep viridans she had before.
Mhm.
And when we told her what bug you had, she said, I don't know. And she had to go to the previous hospital, print for us the culture. So at least when you educate your patient that you need to know two things: the name of your condition, the bug which affects you, keep it in a note. And this will save a lot of time for
Yes.
the future. So having those information just make them, يعني give them the proper
Mhm.
importance, like describe them as important as they are to your patient, so he will keep remembering them. And later on, it might be like some management or future management will depend on those information, whether you provide them correctly or not. So
Yes.
that's the point where you have to, which you need to emphasize on, that please keep a note that you had this condition and it was this bug, and always share it with your GP or any doctor in the future, because it will make a difference in your management. If you don't want to go in details, but at least this is enough to make you take the judgment or take a full mark in the judgment that you are,
Yes.
you gave the proper education to your patient, not
Yes.
just
Yes.
by explaining the current situation, but what he should do in the future, since he had this condition now.
Yes. And remember that whenever they wrote in the scenario Staphylococcus aureus, so they want you to mention it. They might tell you there is infective endocarditis, counsel about it. But in particular, they mention the bug or the organism means there is importance. Why they mention? I said always, anything written in the scenario make importance in the scenario. So be sure it should be mentioned at least once to the patient. And I would add also, whenever this patient remember that he had previous MRSA or sorry, Staphylococcus aureus, and he came next time, as Dr. Hind imagined, patient came again with recurrent infection, and he's shocked, and he remembered the organism. It might be life-threatening condition, and when he remember the bug, it might be life-saving for him. They might start the vancomycin as MRCA coverage, and the patient's condition septic shock might be as a life-saving condition. So it's very important to know and let patient updated about everything in his condition. Okay?
You can make it simple, like mentioning the name of the bug to the patient is not because we are aiming him to remember it, but we will tell him that this bug was found in your blood, and we will give you a note or paper
Yeah.
upon leaving the hospital containing all this information. But it's important for you to show up this paper to any doctor. So I'm not giving him the name to scare him or to make him feel that I'm obligated to remember this medical term, but just to make him understand
Exactly.
how much it is important for him to keep those information, to keep that paper, and to show it up whenever it's proper to any other doctor. And this is the knowledge sometimes the examiner he's waiting from you, that what information he need to know now and what information he need to keep for the future.
Yes, perfect. Thank you, Dr.
Ab-
Hans.
About
Yes, Dr. Hans.
the patient may raise a concern about surgery.
Mhm.
Will I need surgery, doctor?
Perfect.
So
This is
we can. Mm, mm.
yeah, I want to add this point because Dr. Hind also didn't explain it. When we discussed this point, Dr. Hind, it was only for the dental procedure. You can give the prophylactic. This is your question, Dr. Hani? When to give the
No,
prophylaxis?
no. I mean, when the patient asking about the infective endocarditis itself will need surgery to be cured.
Yes. Sometimes, yes.
yes.
Yeah, this is
Oh,
another concern might be raised. Perfect. Good point as a clinical judgment. It might
so
be raised and it might be a surgery secure when? In which
Depending
so
condition?
on the indication.
yes. So most you can say most patients improve with antibiotics alone.
Perfect.
However, in some situations, such
Perfect.
as if the valve becomes severely damaged, or
Okay.
the infection does not respond to antibiotics, or complications develop. In this time, heart surgery might be needed to repair or replace the valve.
Okay. This is if you know their conditions. What if you don't know? Give me a diplomatic answer. Because all of us not cardiologists, and might I remember or might not I remember it. What if I couldn't remember the situation when the surgery will be done? How can I answer it?
Uh, we can say most of the cases will cured by
Okay.
antibiotics,
Okay.
but I don't the same. But maybe I forget the complication,
Okay. At
the
least
indications.
perfect. At least you can say some complication if happened, we will refer you to the heart surgery doctor. And if needed, we can do a surgery to securely. In particular, if the surrogate asks you, doctor, if there is any chance by doing a surgery, or I heard one of my cousins had this condition and he had a surgery. So this is the best answer. You don't remember the indication, the root abscess or the other indication like regurg, severe regurg, or the non-response to the medication. Okay, so if I cannot remember those stuff, I can say as a diplomatic answer, yes, we will follow up you in case there is some condition or complication or no response to the medication and you are fit for surgery. We will call the heart surgery doctor to do the best interest of your condition. This is as diplomatic answer. If you know the condition, you can mention it. However, the diplomatic answer also can cover this point. Dr. Hind, you want to add any comment regarding this point?
لا الله يسلم إيديكم. There's just one thing whenever we discuss the skills, it's always important. I noticed that you separated the judgment from the concern. You should be careful that some wrong answers can make you lose two skills. Like whenever I don't, the concern itself is not, the skills of the concern is not about the answer. It is about to seek the concern, listen the concern, and address the concern. Now, how you address the concern is part of the judgment, because giving correct answers to the concerns, it means that the doctor have a good knowledge and good judgment. Okay, so sometimes if you did not address the concern, or if you didn't seek it very well, and also you answer it wrongly, you will miss part of your mark in the judgment skill and part of your mark in the concern. The beauty of the concern, if you read about the points which you have to fulfill, it's not about how good you are answering. It's even if you don't know whether this will happen again or not, you can tell him that I might look it up and see what are the risk of this condition happening again and whether you have those risks or not. Okay, but for now we need to manage this condition properly and make sure that you recover. So I didn't give him whether it will happen again or it will not, and whether he have a risk factor or not. But since I address it, I will take a full mark in the concern. And since I didn't give a wrong information, I will take a full mark in the judgment. So always remember that some of your talk can make you lose a mark in two skills. Okay, so it's not only about addressing the concern correctly or not. Correctly or not, this is part of the judgment. But whenever we're talking about the concern, it's about seeking. That's why if you didn't engage the patient, for example, in the side effect, and he missed the chance to tell you about a hidden concern, so you didn't do anything, you find yourself missing marks, and at the end, it turned out to be that some hidden concern were slipped from you because you didn't engage the candidate. So concerns are mainly about seeking, bringing up the hidden concern by engaging the candidate, listening. Don't start answering until the surrogate finish completely talking, so good listening and without interruption, okay, and addressing them. Now, how you address them, whether you give an answer or you kept it open for you later on to come back and address it after asking, or like you did it correctly or you did it wrong even. You will not miss marks in the concern. If you did it wrong, you will miss marks in the judgment because you gave him wrong answer and it was a kind of that the candidate gave wrong information or he don't have a proper judgment. So these things are very important to calculate how much you might miss in your skills whenever you address a concern. Okay.
Yes, wonderful. Thank you, Dr. Hind. Now, the open discussion. Anyone want to add any comments? Any question regarding 2 scenarios today? Okay, the last comment. Remember that the exam is not testing or the test for your knowledge. They are testing how you communicate, how to judge, how to be a safe and professional doctor. So be careful. You might answer properly, even if you don't know the information. As Dr. Hind said, maybe they are judging the knowledge. So if you said an answer safely, even if you didn't answer it correctly, you might get the mark. So whenever you don't remember or you are not sure about information, answer it as diplomatic one and be safe while answering this question or concern. Better than saying something wrong and you might have mark down in 2 skills if you answer wrong. One will be for the clinical judgment, but at least address all the concern the patient will raise. Now you can get the mark for the concern and the mark for the clinical judgment. Okay. This is the time to end the session. Before any question, we can say, anyone has a question before ending the session?
Thank you, Dr. Basil.
Thank you.
Okay. Thank you, Dr. Hani, Dr. Hani. Dr. Hind, of course, they are valuable comments usually. And thank you for the all attendee today. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks, Dr. Aish.